The most news in the morning. CNN's American Morning. Weekday, 6 a.m. Eastern.
I'm here at Johns Hopkins Hospital in Baltimore, Maryland. Now, let's say that they brought someone in here who just had a heart attack. It costs a certain amount of money to treat that person. The drugs, the nurses, all of that. Now, Hopkins, like other hospitals, on top of that, charges a profit margin, a markup, if you will. And now to talk about these markups, I'm here with Professor Gerard Anderson. Now tell me, how much of a markup does Hopkins and other hospitals in Maryland charge?
21%.
21%. Now, other hospitals in other states in the country, do they also charge a 21% markup?
No, it's only Maryland that does it. Other states, the markups are much higher.
Much higher. Okay. Well, I'm going to go take a tour of states around Maryland to see how much it costs there to have a heart attack. Now, I've just crossed the line into Delaware, where they mark up prices by 85%. And remember, in Maryland, they only mark up prices by 21%. But wait, it gets even worse. Just cross the line into Pennsylvania, and they have a 277% markup. This heart attack is getting very expensive, but wait, we still have one more state to go. In New Jersey, hospitals hike their prices higher than any other state in the country, 326%. I wanted to understand why hospitals mark up their prices this way, so I've come here to ask the president of the American Hospital Association. Nationally, markups are 180%, we're told. That just seems, to most consumers, that just seems like a huge markup.
You'll find markups in every walk of life, and it depends upon the variables, the cost of providing that particular service, and the factor of how much do you actually, in fact, then get paid.
Other states right next to Maryland charge so much more than what they charge in Maryland.
Everyone doesn't have the same type of payment system that Maryland has.
So, Professor Anderson, how does Maryland keep its markups so low?
Well, there is the state government, and they establish the rates for each hospital in Maryland.
So Maryland takes care of patients more inexpensively. So let's not forget about the patient here. Does that hurt our patient that Maryland's spending less money on him?
No, in fact, the quality of care at Johns Hopkins, the quality of care in the hospitals in Maryland is all quite good.
No doubt, Elizabeth, that if you get sick, Johns Hopkins Medical Center is a great place to go to get treated. But if the state of Maryland, though, can cap what hospitals can charge, why can't every state do this?
You know, it's interesting, John. Back in the 70s and 80s, various states did try it. They said, okay, let's try what Maryland's doing. And you know what? They went right back to the old system. And I bet you can guess why. Hospitals just don't make as much money when you do what Maryland's doing. And those hospitals said, forget it. Let's do it the old way.
So do New Jersey's hospitals, for example, that you showed us, do they usually get paid all of the extra charges that they ask for?
You know what? They actually don't. They don't usually make that full markup. They negotiate a price with an insurance company that's lower than that, but still significantly higher than what they get in Maryland. Now, you might want to ask, well, what do hospitals in New Jersey and elsewhere get? We don't know because all of those negotiations between insurance companies and hospitals are kept secret.